Calcarea phosphorica. Other names: calciphosphas precipita, calcis phosphas, precipitated phosphate of calcium, calcium phosphate. Characteristics and biochemical data. Calcium phosphate is a constituent of the teeth, bones, connective tissue, blood carpules, etc. Bone is 57% phosphate of lime. It has a chemical affinity for albumin, which forms the organic basis for the salt in the tissue cells. Without it, albumin is inert. Calcarea phos is one of the most important elements in the body. It gives solidity to the bones, builds the teeth, and enters into all the important secretions, viz. the blood plasma, gastric juice, milk, etc. It should be prescribed in all cases where albumin is found in the secretions. It is the first remedy to be thought of in the anemia and chlorosis. It is the chief remedy in all bone diseases. Calcarea phos is required in the substance of the bone, while calcarea fluoride is needed in the enamel. It is important in young, soft, and growing tissues. It promotes cell growth and is of the utmost importance in the diseases of childhood. It is necessary to initiate self-growth. When for any reason the molecules of this salt fall below the proper standard in the blood, some disturbances in the vital processes occur. It may be that bone cells are not rebuilt as fast as they die. If the deficiency exists for a great length of time, a condition of anemia prevails, for the bone in whose marrow the red blood carpules are formed is the basis, the foundation stone of the organism. Should the albumin not have a sufficient quantity of calcarea phos to take care of it properly, become a disturbing element and be thrown off by way of the kidney, it is called Bright's disease. If through the nasal passages, catarrh. If by the lungs, a chronic cough ensues. If the albumin reaches the skin, there result pimples, irritations, sores, eczema, and other skin diseases. Calcarea phos is found in gastric juice, and a lack of the proper balance is frequently the cause of indigestion. Calcarea phos is the remedy par excellence in detention, growing infants, and older children. Poorly nourished, pale, thin, emaciated persons are required this salt. It is powerful restorer after disease, a true and rational tonic. Its sphere of action is also found in all diseases of the bone, such as rickets, chronotobes, Pott's disease, spinal curvature, bow legs, deficient or underdeveloped bones, bone ulcers, tuberculosis in the bones, osteitis, parostitis, osteomyelitis, etc. Rheumatic conditions are sometimes due to the deficiency of this cell salt. To prevent an acid condition of the system, a proper balance of natrum phos is required. Under conditions when calcarea phos for any reason is not present in proper quantities, the cells draw upon natrum phos in an endeavor to supply the lack. Thus, a shortage in the alkaline salts ensues, which allows an acid condition, rheumatisms, to exist. Calcarea phos is an auxiliary to the therapeutical effect of magnesium phosphate, as it more nearly resembles that salt than any other. When magnesium phos is clearly indicated and does not restore the normal condition in a reasonable length of time, calcarea phos should be given, for it is quite certain that it has been drawn on from the blood to assist the work of the magnesium phosphate, and it is therefore deficient.